There's a phrase in the Declaration of Independence that sums up the American experience: life, liberty, and the pursuit of happiness. These are all the reasons we protest when our inalienable rights are infringed upon. Now, it's easy to protect these rights that are on paper. That's pretty much a contract between the people and the government. But it's another matter to fight for the things that we need to live. It's beyond me how the people are in the streets protesting, angry in their representative's face about something as simple as our health. Now, when it comes to capitalism, there have been a few restraints that say that no, we can't have this as a money-making enterprise. The first is water. No one can have a monopoly on water. You can't own a river. You can own like access points, but you can't own the river. Air. We need air to live, right? No one can monopolize air. Air's air, and it's free. But what about our health? This has become a sticky situation that shouldn't be sticky because everybody has the right, natural right to live and to be healthy. So the question isn't so much fighting over whether this is a right or not. The question is, how do we get there when our health system is a money-making enterprise? Now, I'm going to bring everybody on back in. Come on back. How many of you have been to the hospital and actually read how much everything costs? The price of prescription drugs, the price just to talk to a doctor, the price for treatment. Now, I'm assuming that most of you have health insurance, so you just do it, you pay your copays, you go about your business. But what happens when you're sick with something that is outside of the stuff your insurance company covers, and you get the sticker shock of that bill? So what's the next step? Does the government have anything to help you out with that? Is there a plan so that you can be protected and still help your kid who has cancer or your cancer diagnosis to stop you from going into debt? Absolutely not. Under our current system of capitalism, you are responsible for that debt. That's the way it is. I'm not sitting there saying that healthcare should be free. That's not what I'm saying at all. But I'm just saying it's not right. And the other part is the hospitals, because they have a Hippocratic oath to treat anyone that comes in there. So if someone doesn't have insurance, they eat those costs. And those costs go into your premiums. And that's why things keep getting more and more expensive. One solution that is out there to keep something simple is prescription drugs. Right now, the United States citizens can only buy prescription drugs in the United States of America that are way maxed out, overpriced. How is that right? Can we all agree on that? The next step is having a healthcare system that can treat everybody and is equitably priced so everybody can get the health they need. Now, is that something we should fight about? It sounds like common sense to me. The only problem is, how do we do that in our current system? We have Obamacare that fought for this, but because we put the name Obama and care instead of just calling it healthcare, it became a political baton. Am I saying Obamacare is perfect? Absolutely not. I believe it was rushed through, and there are things that need to be fixed. But we can't even get to the point of fixing it because the conversation is about, do we eliminate it or do we keep it? We can't discuss anything in between. We can't have an honest conversation about how our system is based around employers covering the cost of healthcare. So what happens when you lose your job? You just SOL and now you got to pay out of pocket for insurance? These are conversations we should be having. but we don't because we're fighting political battles. Our health should not be political. So now let's talk about universal healthcare. Now, let's just get to the bare bones facts of universal healthcare. Now, you can take these facts and you can feel whatever way you want to feel about them, but these are the facts. The life expectancy in the United States of America is 78.54 years. That sounds pretty good, doesn't it? Now, we get to other countries that have universal healthcare. I'll start with our neighbor to North Canada. 81.95 years. Denmark, 80.5. Finland, 81.73. France, 82.72. Germany, 80.89. Sweden, 82.56. And the United Kingdom, 81.26. Now, this is an average. So let me go into all the things that we're working with pre-COVID. I'm not even including COVID in this, so no need to get riled up about that we had a problem with. Our obesity epidemic, diabetes, all these things go into the food we eat. We're talking about the chemicals in our food. We're talking about what we're eating. This is all part of our health. These are ways you can shorten your doctor's visit to stop later problems. But we aren't talking about that. I'm not sure where it came from that we felt that we were invincible. Yes, we have the best doctors in the world. We have the best scientists in the world. We have the best hospitals in the world. But all of this doesn't reflect down to the people being more invincible than other industrialized nations. That's just not the case. We are not walking the walk as a society. And frankly, we're not talking about it. And it's like we don't care until we're forced to care. Until we're forced to go to the hospital and we get that cancer diagnosis and we get that diabetes diagnosis and our obesity starts causing heart problems and other issues. There are things we should be pressuring our representatives about, and this is the most basic of those things, but we're not doing it because we're fighting from our tribes instead of fighting for all the people. Now, when we look at our problem with wages, when we look at the conditions people are living in just to survive, this all comes back to the healthcare conversation and back to the question I always ask: what are we going to do about it? We can have the fiscal conservative argument about it, but it really comes down to let them eat cake, and we really can't do that. We've already seen the anger and the uprisings from both sides. And as long as we ignore this health issue, it's only going to get worse, because you can only imagine what's going to happen when people start fighting for what they should be fighting for. Fighting to live. Not for a political candidate, not for a party, not even for against like the systemic oppression. Fighting to live. This is beyond a black and white issue. This is simply, what does it take to survive in the United States of America if you're not part of the top 5%? That's what it comes down to. Because if you're not in the billionaire class, this is for you. These are all things for you to think about. These are all things for you to push for. These are all things for you to push for Congress to start acting for you to pass a bill. Because it's not going to get done as long as we keep running around in circles like a dog chasing our tail. I mean, this healthcare problem is not going to go away. Lots of work needs to be done, and we can't keep stepping on our own feet to fix the problem. My name is Kyle Flanny King. Thank you for attending my Jeep Chat.